I'm going to bring in my good friend Joe Ripley, who just popped into the studio. Joe, somewhere in this stack of papers, I have your script, but I'm not even going to attempt to find it. You, my friend, take it away. What are you working on today?
Yeah, so today we were spotlighting some of the concern, actually, Dan, when it comes to some of the medical uncertainty surrounding America's healthcare system. You know, as we know, the expiring Affordable Care Act subsidies, those expired at the end of last year. There were also some Medicaid cuts as a result of the One Big Beautiful Bill Act being signed into law by President Trump last year. So a lot of flux in store for many patients, especially those most vulnerable. I wanted to talk to doctors, see what patients are feeling on the ground. You know, we visited Ethne Health. This was a clinic in Clarkston not too long ago, and they serve a lot of our refugee and immigrant community, a lot of low-income families, and families really uncertain, one, about navigating life here in the U.S., but also navigating this healthcare system that they say has become increasingly complicated. So here's a look and listen what they had to say. Dr. Robert Contino runs Ethne Health, a clinic that largely serves immigrants and refugees in DeKalb County. He's kicking off 2026 concerned.
In Georgia, it's estimated that 750,000 people are going to lose their insurance. And I'm almost certain that the large majority of people that lose their insurance are going to be from lower income communities just like ours.
Contino says many of his patients, some of the most vulnerable, are going to be hit hardest by cuts to Medicaid and the removal of Affordable Care Act subsidies. In July, President Trump signed the One Big Beautiful Bill Act into law, which includes substantial cuts to funding for Medicaid and Medicare. In October, the government shut down over whether to extend the ACA subsidies, driving up insurance premiums this year.
We have to realize that health doesn't happen in a vacuum. We need the social services, we need the healthcare system to work together, and seeing our patients not just as a number, but as our neighbors.
Contino's colleague, Dr. Esther Kim, is an immigrant herself. She says lawmakers should reconsider policies that increase access and affordability to care. Chris Denson with the conservative-leaning Georgia Public Policy Foundation says the federal government must rein in spending and cut waste. He says he does not expect Medicaid cuts to impact Georgians as much because the state did not expand Medicaid and does not pay as much as other states in provider fees.
Insurers are attributing the cost of the rise in health insurance premiums to structural pressures like higher medical utilization, inflation, hospital consolidation.
Dr. Contino says Congress needs to act fast because so much is on the line.
It can be devastating. It can be really a matter of life and death.
That is the goal, Dan, for Congress to act quickly. But as we know, that's not always the case. We experienced a government shutdown the last time this issue came up for debate in October. There's a January 30th deadline now for Congress to come up with some sort of resolution. There's debate over whether to resurrect these Affordable Care Act subsidies. As we know, we've already seen patients' premiums go up because of those subsidies expiring. There's also the question of telehealth. Some of these rural and more local hospital care, in-home needs also need to be sorted out. So a lot that Congress is working on, as we know, but this one especially hitting folks hard. A matter of life and death, these doctors say.
The ACA deadline just passed days ago. Some folks choosing to just roll the dice and say, I'm not going to have coverage. I'm just going to hope for the best, essentially.
That is. And, you know, that's some of the short-term and longer-term impacts that we are estimating that will come because of this. Fewer doctor's visits, people rolling the dice, not choosing to be insured, and maybe having to pay some more out-of-pocket costs, maybe waiting a little longer to seek the care that they need. So we'll see what happens.
Okay, Joe Ripley, the debate not going anywhere, so we know we'll continue to talk about it. Thank you so much.